Hello and welcome to Healthcare IT Today, where we bring you the latest insights and interesting stories from the world of health IT. I'm Colin Hung, and I can't wait to sit down with my friend Amy Holmes from Harmony Healthcare IT. They're an American company which happens to be here at eHealth 2024, which is surprising, but a pleasant surprise. I love seeing my American friends up here. And we're going to talk about some of the things that she's seeing different in terms of the conversations that she's having with Canadians that maybe she's not having with folks south of the border. Let's get to it. Amy, welcome to the program.
Thank you for having me.
It's gonna be fun. I mean, usually I see you in the US.
Yes.
And so it's nice to kind of see you in my home territory of Canada. So welcome to Canada.
Thank you. It's great to be in Vancouver.
Well, actually, that's kind of like my first question for you. So as an American company coming to Canada, have you noticed anything a little different? Is there something that you're having conversations here that maybe you don't have as much down in the US?
Yeah, a little bit more explaining what we do, especially with the archiving space. It's a little bit more common and known in the States. So kind of helping people understand what the benefits are and what it can really do to streamline data in the organization and how it can kind of follow along with all of the EHR transitions that are happening.
Now, are you finding it in terms of people who are stopping by, are they really looking at kind of archiving a lot of their old paper documents? Is it other systems that they're migrating from?
It's both.
It's both?
Definitely some paper documents here. But a lot of it is some of those that are moving to Epic or even moving to a new version of Meditech or Cerner, for example. They are having, the old system data, and to be able to move it to an archive and cut off the maintenance agreements on some of those other ones, save a lot of money, and it's a good option for that.
Yeah, and I definitely think that's really going to be key up here because it's publicly funded. We're looking for any ways we can save any money. And if we can archive a lot of that data into something that we can still access through systems that you guys provide and the solutions you provide, then yeah, we don't have to pay those extra licensing fees to keep those old systems running.
Yeah, so that's definitely kind of gotten people's attention as a good option. It's just learning about it and understanding how that can be implemented in their province or their hospital.
Right, and to your point, I think it's just a lack of knowledge, right? Because I think traditionally the EMRs that we've adopted up here, we have kept them running just for the sole purpose of accessing that old data, but there's alternatives.
Right, so with the archive, we can take it from multiple old systems, put it in an archive, and there's a user interface for clinicians to access the legacy records, as well as HIM to do release of information to the patients, or legal inquiries or whatever. So there's a little bit more interactivity than some of the kind of shove it in the closet kind of storage options.
I love that. Now flip the question around. Is there anything that you're hearing up here that's very similar to what you're hearing in the US in terms of topics or technologies?
Same challenges. Moving to an EHR is a big endeavor, it's a big decision. It's going to be a long process. Wanting to do it right, wanting to have the right partners and the right knowledge. Definitely the same challenge, I think, everywhere.
Being in Canada, what are some of your other takeaways from coming on this trip?
I think there's a lot of opportunity in the Canadian market. I think the people are great and friendly, and I look forward to doing more business here.
So Amy, thanks for all the great information you shared. Where can people go to find out more about Harmony Healthcare IT?
They can go to our website, harmonyhit.com.
Excellent. Well, Amy, thanks for being on our program.
Thank you. Always good to see you.
Always good to see you too. Hey, I want to thank Amy for coming on camera with me and sharing her perspective on the conversations that she's having here at eHealth 2024 in Vancouver, British Columbia. It's been really fun to hear how Canadians are finally catching up to Americans in terms of the knowledge of what an archive could do for all that health data that's sitting in our legacy systems. Hopefully the Canadians will realize how much savings they could realize by adopting this approach to that legacy data rather than paying to keep those systems running just for the sake of accessing that information. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.